More and more public health agencies and experts are saying poorly ventilated workplaces are a factor in the spread of the virus that causes COVID-19. In today's webinar, we'll explore the growing evidence of airborne transmission and the need for health authorities to recognize this route of transmission and promote the broader measures, including ventilation, needed to safeguard workers and the public. Hello, I'm Frank Butler, a training service representative with the Workers' Health and Safety Centre, serving workplaces in Southern Ontario. As Ontario's designated health and safety training organization, we deliver a wide range of classroom and now virtual classroom training courses to assist in protecting workers' health by making the workplace safer. Today, we'll talk about the difference between droplet and airborne transmission and why that difference is important when understanding COVID-19 transmission and the various means of controlling exposure, including ventilation. Last week, the World Health Organization changed their stance and now recognize the potential for airborne transmission of COVID-19. That is, transmission by aerosols, which are very small droplets of less than 5 micrometers. A micrometer, or micron, is 1,000th of a millimeter. We'll also explore the many ways ventilation systems in indoor work environments can be enhanced to help prevent the spread of the COVID-19 virus, including prudent actions suggested by globally recognized standard-setting organizations, scientists, and health authorities. Video of this webinar and the presentation I'm showing you will be posted to our website later this afternoon. If you want to share, rewatch, or download, we will send you the specific links in an email tomorrow morning. There has been a long-running scientific debate over whether the virus that causes COVID-19 can be transmitted by a so-called airborne route, as well as through respiratory droplets and contact with contaminated surface. You may have read that recently 239 scientists sent a letter to international health authorities, including the World Health Organization, warning airborne transmission of COVID-19 needs to be accepted as real. The letter said findings from studies demonstrate beyond any reasonable doubt that the virus can survive for at least some time on aerosols which are expelled during exhalation, talking, and coughing. These aerosols are small enough to remain in the air, to be airborne, and pose a risk at distances beyond the precautionary social distancing measure of 1 to 2 meters from an infected individual. On July 9th, 2020, the World Health Organization updated its Q&A page about COVID-19 transmission to include the following. They also released a brief that broadens their past recommendations to include the possibility of airborne transmission. This is very significant. The WHO statement says there has been reported outbreaks of COVID-19 in some closed settings, such as restaurant, nightclubs, places of worship, or places of work where people may be shouting, talking, or singing. In these outbreaks, aerosol transmission, particularly in these indoor locations where they are crowded and inadequately ventilated spaces, where infected persons spend long periods of time with others, cannot be ruled out. More studies are urgently needed to investigate such instances and assess their significance for transmission of COVID-19. Is this really news? Is this aerosol transmission or small droplets, which we have been talking about for a long time? The WHO has created this educational infographic, Avoid the 3 C's, warning people to avoid spaces that are crowded, close, or confined, and especially if they are all 3. If, as you can see, at the bottom in the middle, WHO recommends ventilation as part of the solution. Previously, Ontario's public health directives had set higher protective requirements in healthcare settings where aerosol generating procedures, such as intubation or extubation, putting a breathing tube in or out generate very small aerosols. Now, WHO agrees, evidence increasingly suggests the possibility of aerosol transmission outside of just healthcare settings. For example, during choir practice, in restaurant, or in fitness classes. So why are we in the WHO suddenly talking about ventilation? There are two reasons: good ventilation and bad ventilation. When we speak, cough, squeeze, sneeze, sing, or even whistle, we expel various sized droplets from our nose and mouth. Large droplets fall to the ground fairly quickly. We are very certain the COVID-19 virus remains viable on these large respiratory droplets. To be infected by these droplets, a person would need to be close to or in contact with an infected person, or come in contact with objects that became contaminated. But we also expel smaller droplets, or aerosols, which can remain in the air for as much longer time. The smallest can float in air for hours or even longer than a day. They can travel beyond the current physical distancing protocol of 6 feet and through ventilation systems to other parts of the workplace. But it remains unclear whether the virus can survive on these smallest droplets. Some scientists point to super spreader events where an infected person has infected many people, even people the infected person did not have close contact with. The Government of Canada's Canadian Institute of Health Research released an article about a Canadian study looking at airborne transmission of COVID-19. A multidisciplinary team of researchers are working on the project. In her report, Dr. Luan Zhang, assistant professor in the Department of Mechanical Engineering at the University of Alberta, wrote that airborne transmission involves smaller particles that could, in theory, hitch a ride through heating, ventilation, and air conditioning, HVAC systems as they're known. We don't yet know how far SARS-CoV-2 could travel that way or how infectious those small particles might be. Basically, we want to know if ventilation systems prevent AST, or airborne SARS-CoV-2 transmission, or if they are actually increase its spread. On airborne spread, there's still a lot of unknowns. While scientists seek further knowledge about airborne transmission, workplaces should follow the precautionary principle when selecting workplace controls, including ventilation. Let's look at one very worrying example, one that explains the bad reasons we are talking about ventilation today. These images help explain what scientists believe is an example of airborne transmission of the COVID-19 virus at a restaurant in Guangzhou, China, on January 24, 2020. The image on left shows the original infected person in red and the person who became infected in orange. Video records from the restaurant showed the people at different tables had no direct or indirect contact. That is, they didn't touch each other or touch things in common. The image on the right shows the original infected person in yellow at table A and marked as A1. The people who became infected are represented by red circles. Everyone was at the restaurant on January 24th within a 2-hour period. A1 was already infected on January 24th. They were diagnosed on the dates shown. The Guangzhou Center for Disease Control and Prevention found the spread was likely caused by the air conditioning unit in the room recycling contaminated air above table A, B, and C. They concluded enhanced ventilations were needed to control against similar instances in the future. But there is also a good reason to be talking about ventilation, because while bad ventilation can spread contamination, good ventilation can clear it. Current guidance from health authorities focused on hand washing, sneeze, and cough protocol, maintaining social distancing, enhanced cleaning and disinfecting protocols, and more recently, mask wearing. Public health authorities, including WHO, continue to advocate these steps. The scientists who authorized the recent letter calling for broader recognition of airborne transmission believe current accepted measures are appropriate but insufficient to provide protection for virus-carrying respiratory microdroplets or aerosols. They note this problem is even worse in indoor or enclosed environments. Inadequate ventilation, overcrowding, and extended stays indoors raise the potential for infection. They recommend local exhaust, high-efficiency air filtration, and germicidal ultraviolet lights. So we are now in a situation in which airborne transmission can't be ruled out, but its extent or range is still unknown. There is suspicion that ventilation can aid transmission, but also can help stop it. A lesson learned from SARS back in 2002 and 2003 was the need to commit to the precautionary principle. A good summary of this principle is here. When an activity raises threats of harm to human health or the environment, precautionary measures should be taken even if some cause and effect relationships are not fully established scientifically. Just a reminder, video of this webinar and this presentation will be posted later today if you want to share, rewatch, or download. In this context, the proponent of an activity, rather than the public, should bear the burden of proving its safety. When applying the precautionary principle to COVID-19, employers should assume airborne transmission of smaller droplets in addition to the close contact exposure to larger droplets. So what does that mean for workplaces, particularly by using ventilation? Remember, the Occupational Health and Safety Act requires employers to take all precautions reasonable in the circumstances for the protection of a worker. Not just some, not just the cheapest or easiest. It's not just another mask, as important as they are. If you've taken out courses, you'll know about the hierarchy of controls. Controls at the top are more effective than controls at the bottom. Isolating and working from home eliminates the possibility of workplace exposures, but it may many sorts of work, those aren't viable control measures. The next best control measure are engineering controls, which for COVID-19 might include high efficiency air filters on HVAC systems, increasing ventilation rates, isolation of infected persons in airborne infection isolation rooms. Administrative controls may include a cleaning schedule for air vents on floors, walls, and ceilings. Most indoor workplaces use mechanical ventilation systems to deliver air to the building's occupants. Ventilation is the process of supplying fresh or clean air to a space and removing contaminated air. Ventilation should ensure continuous oxygen containing fresh air, maintain temperature and humidity at comfortable levels, remove toxins or biological hazards from the air. Ventilation can be categorized as either general or local. General ventilation ventilates the air for an entire building. The system may use 100% fresh air or recirculated part of the air already in the building. Unfortunately, most buildings recirculate a large amount of air because recycled air is cheaper to cool or heat than outdoor air. Local ventilation ventilates a particular small area. and is often used to remove hazardous materials from a work process before they can escape to the rest of the room. Local ventilation can also include opening doors or windows in a room to allow for more fresh air in a room. Improper ventilation can fail to completely remove toxins or contaminated air from an indoor space, or even contribute to the spread of contamination. Open windows and doors can help to aid fresh air to a room, but might bring in contaminants from the outside. Open windows and doors may help remove some contaminants from a room, but not all. Rather than remove contaminants, open windows and doors dilute the contaminated air. We need to keep in mind with COVID-19, recirculated air may trap the virus in one area, simply moving them around. Ventilation systems need to have effective filtration. Without filtration, ventilation recirculates contaminants within the enclosed environment. Airflow patterns, the air current created by ventilation, also matter. Air should never flow from one worker to another worker. Ventilation should bring clean air to a worker and move contaminants away from them. So how do we make sure we have ventilation that is healthy? Globally recognized standards setting organizations, including the American Society of Heating, Refrigerating, and Air Conditioning Engineers, known as ASHRAE, have considered this problem of possible airborne transmission and developed recommendations. In addition to ASHRAE, many other organizations, including the U.S. Center for Disease Control and Prevention and the Occupational Safety and Health Administration, have recommended a range of precautions, including ventilation to reduce indoor airborne levels of COVID-19 to reduce the chance of transmission. The following are just some of the precautionary actions suggested by ASHRAE, OSHA, and the CDC. Assess the heating, ventilation, and air conditioning HVAC system to ensure it is functioning properly. Consider ductwork and all air purification systems and use a certified technician for such work. Increase ventilation rate and run ventilation systems longer than normal, 24/7 if possible. Ensure exhaust fans in bathrooms, change rooms, break or lunch rooms are operating at full capacity and running continuously. Minimum efficiency reporting value, commonly known as MERV, is a measurement scale designed in '87 by the American Society of Heating and Refrigerating and Air Conditioning Engineers. Once again, ASHRAE. It reports the effectiveness of air filters. Higher MERV rating means finer filtration, meaning fewer dust particles and other airborne contaminants can pass through the filter. ASHRAE suggests using a high efficiency filter with a minimum value of MERV 13 to filter air which might be contaminated with COVID-19. Ensure filters are within their service life and properly installed. Older filters or poorly installed filters will not filter air effectively. ASHRAE guidance mirrors recent study findings where it suggests keeping relative humidity levels in the workplace between 40 and 60% if possible. The study appearing in the annual review of virology found very low humidity can allow COVID-19 to move around more freely, while very high humidity may help COVID-19 remain viable longer on surfaces. Humidity between 40 and 60% was the least hospitable to the COVID-19 virus. Increase amount of clean outdoor air circulating into the system to reduce or dilute any contaminants. Minimizing the effect of outdoor air dampers will help. Closed dampers are meant to stop outdoor air from entering a building. they need to be open to allow air in. Disabling demand-controlled ventilation so outdoor air intake is not reduced based on occupancy also helps. Where possible, opening windows and doors to increase intake of outdoor air is beneficial too. Be mindful not to create new hazards. Consider external pollutants and any potential functional impacts open doors and windows may have on the HVAC system. Ensure air from the breathing zone of one person is not flowing directly into the breathing zone of another. To help accomplish this, consider airflow from general and local exhaust ventilation systems, along with windows, doors, and fans. Workstations may need to be repositioned accordingly. Every layer of defense is important for controlling the spread of COVID-19. Another layer ASHRAE suggests is clean space air cleaners. These cleaners use several different air purification technologies, including HEPA filters, activated charcoal filters, electrostatic filtration, and even ultraviolet irradiation. The device in this picture may look like a fan, but is also an air purifier with a HEPA filter. Clean and disinfect all HVAC intakes and returns daily. Use ultraviolet germicidal irradiation in the ventilation system where available. This destroys or inactivates microorganisms. When it comes to healthcare facilities, even greater care needs to be taken with building ventilation. Healthcare facilities, including any medical, paramedical, dental, or care facility, ASHRAE developed a standard of requirements for such medical settings. Elements of this standard include using airborne infection isolation rooms, increasing air exchange rates in other rooms such as soiled linen, sorting and storage, and janitor closets to 12 air changes per hour, keeping infected patients in resident rooms doors to hallways closed if possible, installing the same ventilation system used in hospitals, emergency rooms, in dental, and in clinic offices. Ventilation should move from a clean area to a contaminated area, and not the reverse. Contaminated air should always be pulled away from workers to the outside. Airborne infection isolation rooms are kept under a slight negative air pressure compared to halls and adjacent rooms. They prevent movement of contaminated air to communal areas and adjacent rooms. Contaminated air needs to be exhausted to the outside. These rooms require more changes of air per hour than, for instance, an office. At least 2 changes per hour must use outdoor air. Wherever possible, it is preferable to undertake aerosol generating procedures, including patients and including dentist offices, in single, well-ventilated, negative pressure rooms with closed doors. Following aerosol generating procedures, cleaning and disinfecting must be performed, but only following a period where the room is left empty with doors closed to permit clearance or setting of aerosols. How long the room is left empty will depend on the air exchange rate and how many exchanges, including outdoor air. For instance, where there are 12 air changes, 2 of which are from the outdoors, the room should be left empty for at least 35 minutes. Employers have an obligation to follow laws to do with air quality and ventilation in buildings. Moreover, the Occupational Health and Safety Act requires employers to take every precaution reasonable in the circumstances for the protection of a worker. Enhanced ventilation is a reasonable precaution as part of an overall workplace safety plan to control COVID-19. Employers must prepare and review, at least annually, a written occupational health and safety policy and develop and maintain a program to implement that policy. The Occupational Health and Safety Act requires workplaces' occupational health and safety policies to be updated to include assessment and control of COVID-19 in the workplace. Members of joint health and safety committees and health and safety representatives are part of the solution. Members of the joint committee might want to get information from the employer about the ventilation in use, the filters being used, the replacement rates, the cleaning schedule. This is information the employer or the property management company may have and should share. An employer has the legal duty to share any health and safety report it has. It is the function of a joint committee and representatives to make recommendations to an employer, including recommendations about enhanced ventilation. Employers and workers should agree to waive the 21-day response time to recommendations because there is an urgent need for timelines when dealing with COVID-19 recommendations as we reopen workplaces. And remember, the employer does need to consult joint health and safety committee members or worker health and safety representatives before performing industrial hygiene testing strategies, including air quality testing. A health and safety representative or designated committee member is entitled to be present at the beginning of testing to ensure valid test procedures are used or to ensure test results are valid. This webinar is one in a series we've developed to help you stay safe throughout the pandemic. If you want to download this or any of our COVID-19 presentations, go to our website, WHSCtraining.on.ca. A video of this and all of our webinars will be posted on our YouTube channel, WHSC Training. This PowerPoint will be posted to our website. You'll get a follow-up email tomorrow morning giving you the exact links. Also on our website, you can find a WHSC fact sheet about enhanced ventilation and many other useful fact sheets. In addition to this series of webinars on COVID-19, the Worker Health and Safety Center is now offering virtual classroom training. We've modified a number of our most popular programs so they can be delivered via a virtual classroom, including certification training for joint committee members. Recently, we added a course on the hazards posed by the virus that causes COVID-19. You can register for our virtual classroom training on our website or by contacting one of our training service representatives. If you want to download a copy of this presentation, you can get it from our website. And if you want to watch this webinar again or send it to someone by tomorrow, you can find it on our YouTube channel, WHSC Training. You'll receive a follow-up email tomorrow morning with the exact link. You can also follow the latest developments via Facebook or Twitter. Let us know how we did today by completing the poll posted on your screen. Let us now take some questions. First question, how do I assess my work HVAC system? All HVAC systems need to be assessed by a certified HVAC technician. Your employer or building owner would need to call and set an assessment. Next question, is this suspicion that aerosols can carry the virus new? No, in fact, we've been talking about the possibility in these webinars for a couple of months now. Several months ago, a lab test showed the virus remained viable on aerosols, but many medical scientists argued that perhaps the virus could survive on aerosols in lab conditions. But if it was happening in the everyday world, we'd see a lot more evidence of infections that couldn't be explained by droplet or contact transmission. So there has been a debate, and as the evidence on airborne transmission has grown, the health authorities are being more cautious about aerosols. The advice to avoid places where people are crowded, close, or confined is new. And just a caution here, Some viruses can survive on an aerosol for a very long time, drifting from room to room. That doesn't seem to be the case with the COVID-19 virus. The cases suggesting airborne transmission seem to be closer, like a single room, as we saw in the restaurant example. But this is still an open question. Next question. I work in a drugstore that often has several shoppers in it at a time. I'm worried about airborne transmission. What can we do? To specifically protect from aerosols, your employer should ensure the number of people in the store is managed so customers can remain 2 meters away from one another. Customers and staff should always be wearing masks while inside the store. And of course, the employer should assess and update the ventilation system to improve the flow of clean air into the store. These measures together should keep down the number of airborne droplets and aerosols in the air. And of course, you need to keep up the precautions from droplets and contact transmission. Next question. You mentioned opening windows might not always be a good idea. Why is that? It depends on where the window is located and what is outside. If the window brings in clean, fresh air, that's great. However, if the window is beside a main street, you might be bringing in diesel emissions or carbon monoxide instead, which is unhealthy. On a hot, windless day, opening a window may not bring in much fresh air and might also bring in too much humidity, given the virus is humid environment inside and allows it to better grow. Also, be careful of airflows. Think about the fan picture. We want air currents to carry any droplets and aerosols away from workers, not from one worker to another. Lastly, how do I get more information about the sources you mentioned during the webinar, such as ASHRAE? You may find many of the sources talked about today on the COVID-19 pages of our website, WHSC.on.ca. You can also check the ASHRAE site, which is ashrae.org.